Hi, my name is Naomi LaFleur. We will be presenting our role competency on guidance and coaching. First, I'm going to define what guidance and coaching is. Guidance is done by the nurse, where coaching, it focuses on empowering the patient to manage their own care. The official definition of guidance is a style and form of communication informed by assessments, experiences, and information that is used by the APN to help patients and families explore their resources, motivations, and possibilities. The APN's guidance goals are to raise awareness, competence, implement, sustain a behavioral change, manage a health or illness situation, prepare for transitions. The official APN diagnosis of coaching is a purposeful, complex, dynamic, collaborative, and holistic interpersonal process aimed at supporting and facilitating patients and families through health-related experiences and transitions to achieve health-related goals mutually determined. The goals of coaching are higher level of wellness, risk reduction, reduce morbidity and suffering from chronic illness, and improved quality of life.
Hi, and I'm Angelica. I'll be talking about HAMRIC's core competencies. Guidance and coaching is an essential feature of the APN framework. One of the earliest efforts to synthesize a model of advanced practice that would apply to all APN roles was developed by HAMRIC. HAMRIC proposed a conceptual definition of advanced practice nursing and defining characteristics that included primary criteria and a set of core competencies. There are 7 advanced practice competencies, with direct care being the core competency on which the other competencies depend, such as our assigned competency, guidance, and coaching. Then there are environmental and contextual factors that must be managed for advanced practice nursing to flourish. APN-led patient education and monitoring programs for specific clinical populations have demonstrated that guidance and coaching are central to their effectiveness. A significant portion of an APN's direct care time is spent guiding and coaching. APNs practicing to their full scope must be mindful that theirs is first and foremost a therapeutic relationship in which they integrate their additional guidance and coaching preparation as they care for patients. Guidance and coaching require that APNs must be self-aware and self-reflective as an interpersonal transaction is unfolding so that they can shape communications and behaviors to maximize the therapeutic goals of the clinical encounter. Through guiding and coaching, APNs help patients and families make sense of their experiences of health, illness, and other transitions because of their direct practice experience and insight.
Hi, I'm Janet Kimball, and I'd like to talk about the characteristics and traits of coaching and guidance role competency. Some of the highlights of this competency include its use of a holistic perspective, reflective practice, interpersonal interventions, and it reflects an integration of the characteristics of the direct clinical practice competency. And it's dependent on the formation of therapeutic relationships with patients. Guidance and coaching require that APNs be self-aware and self-reflective. Individual elements of the guidance and coaching model include an interaction of 4 factors. The 4 factors are self-reflection, technical, clinical, and interpersonal competence. Self-reflection is the interaction of all aspects of the technical, clinical, and interpersonal competencies. Technical competence is the advanced practice nurse's education, it's her specialty knowledge and skills, her experience before and after graduate program. And clinical competence is the holistic perspective, clinical experience, intuition, and the clinical decision making. Attributes that the preceptor coach must possess include technical and clinical competencies. Misty will elaborate on interpersonal competence trait.
I'm Misty Spillman, and I'm going to talk about the 4 characteristics of guidance and coaching. Interpersonal competence. It includes a set of advanced communication skills that helps APNs establish therapeutic patient relationships. There are 7 elements that make up interpersonal competence, and they help differentiate APN guidance and coaching from other nurses and health coaches. The first element is the ability to create therapeutic relationships. The APN must respond emotionally, show empathy and caring, while maintaining professional boundaries. The second element is person-centered approach. APN takes an advanced approach to plan, deliver, and measure health care that is based on mutual beneficial partnerships among patients, families, and other healthcare providers. The third element is knowing the patient. Knowing and understanding the patient's perspective and recognizing individual patterns and health-related occurrences in those patterns enables the APN to collaborate with patients to create goals and plans. Empathy is the ability of the APN to understand the patient's perspective as well as demonstrate the understanding back to the patient. It helps them to communicate effectively. This also helps to reduce the stress the patients are experiencing and provides for a more productive therapeutic relationship. The fifth element is cultural competence and cultural safety. APNs must protect the patient's cultural identity, practices, and well-being by assuming a stance that demonstrates the awareness of how a particular group is perceived. The sixth element is other advanced communication skills. APNs pay close attention to verbal and nonverbal cues expressed by the patient, family members, and other healthcare providers. They use these cues to elicit further information from the participants. The last element is motivational interviewing. The APN participates in active and careful listening and asks strategic questions that engage the patient in self-reflection that is aimed at understanding and resolving a patient's feelings and concerns about changing health behaviors.
Hi, my name is Francine, and I'm here to discuss the different stages that require coaching and guidance. There are 4 categories. They are health and illness, developmental, situational, and organizational. The first example is on health and illness. Mrs. H is a 34-year-old African-American female who is obese and a newly diagnosed type 2 diabetic. She is familiar with the disease as her mother, grandmother, and 2 aunts are diabetic. Fearful of the long-term negative effects of the disease, she is motivated to make her lifestyle changes to avoid the negative consequences. As an advanced practice nurse coaching Mrs. H, the dominant focus is physical. The coaching process will first involve demonstrating self-care. We will be showing her about the signs and symptoms of hyper and hypoglycemia, self-monitoring of her CBGs, her medication regime, and dietary modifications. Also, we're going to identify risk factors for her, which is her family history, her obesity, her dietary choices, and her sedentary lifestyle. We're going to offer strategies to modify the risk factors: dietary counseling, referral to an exercise program, and referral to a diabetic support group. The possible outcomes that we're hoping to see is an effective self-care, which would include self-monitoring of her CBGs, compliance with her medication regime, regular exercise program, and attendance of her support meetings. We also hope to have improved functional status as shown with hemoglobin A1C levels of less than 7%, CBGs within normal limits, a decreased BMI, and an increase in her physical stamina. The next example I'm going to give is on the developmental situation. Rosie is a 16-year-old white female whose parents have been divorced for 5 years. She's been living with her father because her mother is no longer able to deal with her delinquent behaviors. Rosie's been skipping school, and she's involved with a 25-year-old man who's abusive and controlling, possessive. Now she presents to the health unit because she is pregnant. She doesn't know what to do. She says she doesn't want an abortion, and she feels that she can mend her relationship with her mother. Eventually, she does want to move back with her mom. So in coaching Rosie, we're going to have a dominant focus of cognitive behavioral aspect. The coaching process is going to identify adaptive tasks that Rosie needs to deal with. She'll need to adapt to psychological and the physical effects of pregnancy and to the role of motherhood. Her presenting challenges will be the choice to keep the baby, her limited resources, moving back with her mother and repairing that relationship, continuing with her education, and ending the abusive relationship. The cognitive coping strategies Rosie needs is education on how to manage the changes of pregnancy and guide her into effective communication with her mother and hopefully reestablish some trust there. Referral to the nurse-family partnership, and to end the abusive relationship and educate her on the effects of domestic violence. The possible outcomes that we're hoping to see are behavioral and lifestyle changes. A restored relationship with her mother so that her mother can support her with the baby, continuing her education and having some future goals and plans, and ending the relationship with her abusive boyfriend and taking steps to ensure her safety. Another outcome is for her to have some decreased stress in her life, which if she takes the positive lifestyle changes, then she will have increase in her empowerment and increasing in her self-esteem. Thank you.
Hi, my name is Ginger Fontenot, and I will be talking about the situational transition and the organizational transition. An example of a situational transition would be a change in living situation. Mrs. R is a 61-year-old female with a history of seizures and has become unable to work. She lived alone in her home and is unable to continue paying her mortgage. So she sold her home and moved into her daughter's apartment on their property. As an APN coaching and guiding Mrs. R during this time, the focus could be effective, interpersonal, and spiritual. The coaching process will include acknowledging Mrs. R's expressed and possible fears and concerns about the move, encouraging Mrs. R to be honest with her family, and reassuring Mrs. R during this difficult time that having family support will be a positive aspect of the move. The possible outcomes from coaching and guiding would be acceptance of help from others such as her daughter and son-in-law, and improved quality of life with the ability to still remain independent and yet have the social support she needs if her physical health deteriorates. An example of organizational transition would be a change in leadership, such as a new manager. The APN is a hospital employee in a labor and delivery unit. The department has recently changed managers, with the old manager having been there for over 15 years. The change will require the APN to guide the fellow staff members and the new manager, and the focus will be social. The coaching and guidance process will be advocating to ensure that the unit remains positive for both patients and staff, facilitating important relationships between the managers, staff, and hospital administration, and collaborating with physicians, management, and staff through the transition period. The possible outcomes of this guidance by the APN would be minimizing alienation of the staff members and the new manager, as well as improved satisfaction for all staff members on the labor unit.
The final portion of our presentation is research. My name is Tina Mook, and I'm going to discuss 3 articles with us today. Article 1 is titled Advanced Practice Nursing Core Competencies. It evaluated patients in the hospital and through and after to their discharge process of home whenever they had blood and bone marrow transplants. They wanted to improve quality of life and decrease morbidity using coaching and guidance. Expert coaching and guidance was demonstrated by knowledge, expertise, the ability to tailor evidence-based guidelines into practice, and help educate the patient and family, and the ability to use adult teaching principles. They use expert coaching by thoroughly explaining what to expect in the first week at home, what interdisciplinary care they should still receive at home, and answered any questions the patient and their family had. They would write all of that information down in a notebook and send the notebook home with the patient. The coaching was used to establish a trusting relationship with the patient and their family to assist them in this tough time. So this article showed improved outcomes with advanced practice nurses using coaching and guidance and decrease in health costs. It showed improved patient satisfaction, decrease in hospital readmissions, decrease in complications, and improved the patient's health status. There was a quote that said, NPs have equal or better clinical outcome compared to physicians in the primary care setting. Article 2 was titled, Coaching as a Nurse Practitioner Strategy. The purpose of this study was to explore how coaching used by nurse practitioners would improve patients' health outcomes and lay a foundation for validating benefits used by coaching. Coaching is a way to help people achieve their goals that are important to them, to help encourage and inspire the patients and empower them to meet their maximum health potential. Part of the nurse practitioner's role using coaching is to be holistic and use collaborative care. It's innovative and effective to prevent illness, and it's been proven to be a better approach than persuasion or coercion, which has proven to not work in the past. This article explained that coaching involves passing on their expert knowledge, listening to the patients, and using coaching as a communication strategy. It was important to note that some people don't want to change, and your influence will not make them change. But there was a quote that said, patients will succeed if they believe they can, and it is the APN's role to be the coach to inspire that belief. This study did show positive results. They measured biomedical outcomes and said that the coaching intervention showed improved outcomes. The final article was titled Alliance Not Compliance, Coaching Strategies to Improve Type 2 Diabetic Outcomes. They were looking at the hemoglobin A1C, lipids, and the BMI. They discussed that coaching is really important because it's cost effective and there is no cost associated with the coaching. They said that the NP needs formal education and that it is a strong provider communication skill that can be learned. And that coaching has been proven successful in the past with sports, business, and psychology. They suggested that coaching will help the patients to take small steps to accomplish big goals, that successful outcome is imperative, and there should be a feedback loop associated with gratification and motivation. The results of this study showed that nurse coaching was associated with improved hemoglobin A1C, lowering lipids, and lowering the BMI. They said that coaching helps to raise the patient's awareness of the problem and their need to change, and discussed that some other areas in which coaching has proven positive outcomes is older patients with chronic illnesses, adolescents with asthma, patients with urinary incontinence, and heart disease. This is the end of our presentation. Thank you.